This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Eris, senior attending in neurosurgery.
And I'm Dr. Alara, research fellow. Today, we're looking at a fascinating new study from the 2026 issue of Epileptic Disorders, titled Beyond Broca and Wernicke, Epilepsy Surgery in the Language Areas.
This is a timely review, Alara. For decades, we taught residents that language was essentially two spots on a map, Broca's and Wernicke's, connected by a single white matter bundle. But this paper really emphasizes how that classical model has been superseded by a much more complex distributed network view.
Exactly. The authors argue that language is a dynamically interconnected system. This shift in understanding fundamentally changes how we approach the pre-surgical workup. It's no longer just about avoiding a specific center, but about understanding the patient's unique functional connectivity. They highlight that neuropsychological testing isn't just for a baseline. It's actually a tool to help define both the functional deficit zone and the epileptogenic zone.
Right, and that leads into their discussion on imaging. We've moved quite far from the invasive WADA test being the gold standard for everyone.
Definitely. The paper focuses heavily on bold fMRI for lateralization and localization. But what I found particularly interesting for our pediatric colleagues was the emphasis on resting state fMRI. For patients who can't follow complex task protocols, like young children or those with cognitive impairments, RS fMRI provides a task-free way to map these language networks.
It's a huge step for accessibility in the clinic. Now, when we get into the more invasive side, the paper spends a significant amount of time on stereoencephalogram, or SEEG. As we know, SEEG is pivotal for identifying the epileptogenic zone, but the authors go deep into how we use it for functional mapping via electrical stimulation.
That was one of the most technical deep dives in the article. They discussed the use of different stimulation frequencies. While high-frequency stimulation is common, the authors advocate for the utility of intermediate-frequency stimulations. The benefit there is that they are effective for mapping, but carry a lower risk of inducing post-discharges, which can obviously cloud the results or even trigger a seizure during the procedure.
It's a delicate balance. You want to be aggressive enough to find the boundary of the language area, but cautious enough to avoid a post-discharge that halts the mapping session. The paper also mentions the role of corticocortical evoked potentials, CCEPs, as another task-free neurophysiological tool. It's essentially measuring how one area of the brain talks to another in real time.
And that connectivity data is crucial when we decide on the surgical strategy. The study outlines everything from focal resections to hemispheric procedures, but what's really changing the field are the minimally invasive options they highlight, like stereoencephalogram-guided radiofrequency thermocoagulation, or RFTC, and laser interstitial thermal therapy, or LIT.
LIT is becoming a favorite for deep-seated lesions near eloquent areas because it's so precise. The author suggests that our selection of these tools depends entirely on the accessibility of the epileptogenic zone and its extent. We are moving toward a highly integrated multimodal approach where we layer fMRI, SEEG, and tractography to create a patient-specific safety map.
They wrap up with a look at the future, specifically how machine learning and AI might be used to analyze these massive datasets we collect postoperatively. The goal is to eventually use AI to predict long-term seizure freedom and functional language outcomes before we even make the first incision.
It's an exciting time to be in the OR. This paper really reinforces that eloquent doesn't mean inoperable. It just means we need better maps and more precise tools.
Absolutely. It's a great read for anyone looking to modernize their approach to epilepsy in these sensitive regions.
Well, that's all the time we have for this segment. Alara, would you like to summarize the next major section of the paper, perhaps focusing on the specific surgical outcomes mentioned in the later chapters?